I'm Jeff Darwin. I'm a past grateful patient and a board member of the Queensway Carleton Hospital Foundation. What brought me to Queensway Carleton initially was, like most of us, an injury, if you will. 38 years ago, my first encounter with the QCH was a football injury, high school football injury. Brought me here, had knee surgery done then, shortly after the place had opened. I remember thinking at the time, as a teenager, it was a fabulous place, carpeted hallways, and they gave me a private room and made a big fuss over me. So and that was my first and very positive interaction with the Queensway Carleton Hospital. This is my hospital. I live in the neighborhood. I knew it was always here, but didn't have very much need for the hospital for many years. I guess to back up, I did have a fairly recent interaction with the hospital, but to give you an idea of what it meant to me, I have to back up to an interaction that my sister actually had with a community hospital not far from here. My sister Kim in 2002 was feeling unwell, and she went to a community hospital not far from here. And she went to her own doctor and to that community hospital 2-3 times over the course of a week, was not properly diagnosed, and unfortunately she passed away in 2002 from something that should have been diagnosed at the time. With that in the back of my mind, and put out of my mind frankly, in 2010 I come to the QCH feeling unwell, completely different set of circumstances. However, I come here and feeling unwell. They check the regular stuff right away. They say it's not your heart, and that could have been the end of the story, except Dr. Neil McGee, emergency physician here, took the time, said, well, it's not your heart. He said, but I'll sit down and ask you a few questions. And he asked about the family history. And with that, he said, so tell me about your family members, who's with us, who's not, and so on. And keep in mind, this is the QCH emergency facility, so it's the busiest one in Ottawa. And he hears about my sister and he says, I think I have an idea. He said, do you have a couple hours to wait till our CT scanner is free? I said, sure. And with that, he diagnosed me with the same condition that I lost my sister on. So, with thanks to Dr. Neil McGee, my life was saved at the QCH. Perfectly treatable. Once the condition that both my sister and I had pulmonary embolism. It's an idiopathic genetic blood condition, predisposition to hypercoagulability in the blood. And once they know that, it's very easy to treat, and it's not life-limiting in any sense. And I think the difference here at QCH, and particularly with the experience I had in 2010, they took the extra time, despite the lineups, to find out what else could be impacting on that after determining, well, if it's not your heart, there's nothing going to kill you this evening, send you on your way. So for that, I'm eternally grateful.